Hi, my name is Gabby and I'm going to be the massage therapy student for today. In the video today, we're going to be discussing hydrotherapy, and in specific, we're going to be doing cold therapy, or it's also can be known as cryotherapy. So in the case given from the school, it was an older gentleman that injured his left radius 6 weeks ago and recently came out of a cast. And it also says in the case study that there's some swelling. So since there's swelling, you would automatically resort to cold therapy instead of hot therapy, since you want to reduce the inflammation and the pressure buildup within the joint itself and the joint spaces. So along with swelling, there's also other signs and symptoms that you should be aware of to determine if cold therapy is a proper massage technique that you could use during your treatments. So swelling, obviously one of them, and then you have to look at redness and heat, and then you have to look at obviously pain, and then pain while moving or during resistance. So based on the client's given information, he's probably in the subacute stage since he's already reached his 6-week point. So the goal here would be just to reduce some inflammation, develop mobile scar tissue, and develop or start to develop more range of motion. So this all can be done during, like, before your actual ice massage. You can do this by light techniques such as like effleurage, light frictions, joint moves, things like that that won't actually aggravate the tissues and the muscles that you're actually working with. So to start, you're going to apply ice directly to the site of the complaint. And then you're going to move it in circular motions. So here I have a styrofoam cup, and I'm going to peel it back. There's ice and I froze it overnight. So I'm going to peel it back. This is what we're going to use. And you're also going to have some paper towel handy just because it will melt. And then just peel it back like that. It's a little bit stuck here. And peel it back so there's like an edge for the ice there. And throw the rest down into the garbage. So yeah, while I peel this back, I'm just going to talk about the stages. So there is stages with this kind of ice massage. What I mean by that is there's symptoms associated while you're doing this. So the patient will feel coldness, burning, achiness, and then numbness in that order. And basically what's happening here is that your blood vessels are vasoconstricting and vasodilating periodically in response to the dramatic cold you're going to apply onto the skin. So these two act together to provide systemic blood flow, and it also delivers nutrients and reduces swelling, stuff like that to the injured area. So what we want to do here is you want to do it up to 15 minutes, or in other words, do it until the patient feels numbness. That's how you know all the 4 stages have been completed. And with this, you have to just keep in mind patient feedback, let them know what stage they're in, keep talking to them. So let me just start. Left radius right here. What you want to do here, you can start with the edge here, but I feel like the edge is a little bit too sharp, so I'm just going to apply with the whole thing. And then quick circular motions there, all around the radius. Okay. So yeah, I definitely feel coldness right now. And just fast circular motions there. And you don't want to stay on one spot the whole time, like slowly like this. Just because they can develop frostbite, and that's something that you don't want to happen. And just go around. Again, I've already reached the coldness stage. That comes pretty fast. They automatically kind of feel cold because it's a cold thing that's touching their skin there. And then again, it's going to get pretty wet. I have a towel under, but if you're actually in treatment, you can just wipe it off with a paper towel. Okay. Yeah, and these 4 aspects or symptoms that come along with the massage, the cold massage. So coldness, burnness, achiness, and numbness is called as Huntington's response. Just to be more precise. We're just gonna keep doing that. So again, as I mentioned earlier, it's going to be periodically vasoconstricting and vasodilating. So it's kind of going to act like a pump, just to pump out the swelling, inflammation, and deliver nutrients. And it also reduces pain. So yeah, I already feel some burning going on. And then you also want to keep in mind certain contraindications that would be going along with this. For example, if somebody has Raynaud's phenomenon, where it's kind of like your fingernails turn blue and you have just spasm of the vessels, like overconstriction, then they're not going to have as much blood flow and they're always going to be cold. So that's something you want to keep in mind. Okay. There's a little bit of achiness there. And again, it might take longer in some people. Kind of works fast on me though, so. And then as the ice starts to melt, you can always peel back the styrofoam even more. And then again, fast motions there. Okay, and again, some people take faster than others. So it could take a couple minutes, could take pretty fast. I'm pretty much almost at the numbness stage there. However, I don't have any inflammation, so you might not see an adverse effect there. Just pick that off there. Continue on. Okay, and then you would do that until the person feels numbness, dry them off. And I would also end the treatment like that, so it's not, so when you're going back into your effleurage or whatever techniques, you're not pumping blood flow back in, right? You want to reduce inflammation, so this is something I would do at the end of the treatment for sure. And just to kind of inhibit inflammation and reduce pain by the end of treatment, and then you can continue with the other limb or just end the treatment. That would be the hydrotherapy and specific cold therapy, and you can use this as a modality within your treatment.